you?
You're used to all of that.
Yeah,
You're normally outside in the cold.
True, yeah.
Get your big coat on.
Waders. Haven't been out this year so far. Fingers crossed.
Now, uncertainty over the severity of the Omicron variant, the hospitalisation rate and the impact of the booster jab has led the Prime Minister to rule out bringing in tougher COVID restrictions before Christmas in England.
But what happens after Christmas? That's what we're asking this morning. And all this is in stark contrast to what's happening in Scotland and Wales, who've already imposed stricter measures. Let's check in with two of our regular experts now. Virologist Dr. Chris Smith joins us. Morning, Chris. And Professor Sian Griffiths, an emeritus professor at the Chinese University of Hong Kong. Thanks both for joining us this morning. I think there's an awful lot to get our heads around. Should we start with this change that's coming in England that the government's announcing this morning, where people can end their self-isolation a couple of days earlier, Chris, if they get two lateral flow results negative on days 6 and 7. As a virologist who understands this COVID, what's going on, does that make sense to you that people can be clear of it, can be safe after a shorter time than maybe we originally thought?
Morning. Well, one of the big risks with this particular surge in virus is that if lots of cases all crop up all at the same time, and you've got lots of relatively healthy people who are isolating because they've caught it, been trivially unwell, but they're going to recover uneventfully, but they're being robbed away from the workplace. This could jeopardise certain key industries as well as other industries. And if really the benefit conferred by staying in isolation for that bit longer is very small, then it's possible to make a judgment call and say, well, what fraction of cases would be attributable to allowing people out a bit sooner? And if the answer to that question is such a tiny fraction that it really doesn't justify, in the grand scheme of things, asking people to stay isolated, that's really behind this. And it's supported by the facts, because if we look at when people are most infectious with this variant, as well as variants experienced hitherto, it's a very skewed curve. You don't switch on your infectivity as soon as you're infected, stay infectious for 10 days, and then switch off your infectivity. It's very skewed towards the beginning of your infectious period. So you catch the infection, you incubate it for a few days, then your level of infectivity, the amount of virus leaving your body, goes flying up to near maximum. And then it very quickly, just usually if you're going to get symptoms, as the symptoms kick in, it then tails off. It then drops to really low levels and stays at really low levels after that. So most of the transmissions occur right at the beginning of the incubation period, even before people have symptoms. So shortening that isn't such a bad idea. Shortening it and adding the added security of we'll do a couple of tests that are actually quite good at detecting whether someone is infectious or not. That's what the lateral flow tests do. This seems reasonable to me and a good compromise under the circumstances to keep people sort of safe, but also keep key industries operating.
Sian, if I could come to you, I know that there is a delay on the data that's released, isn't there? And we're waiting for new data to come through at the moment. What does the current information that we have tell us about Omicron and how concerned we should be?
Good morning. Yes, we exist at the moment in a state of uncertainty. There are so many unknowns about Omicron. But from the data that exists at the moment, and don't forget, data always comes out with a lag, because it takes you, as Chris was saying, you get the infection, then you get the symptoms, and then for some people you need to go to hospital. And that may be about a 2-week period. So there's always a lag, and there's also a lag in collecting data. So when we get data, we're looking at what's been happening, not what's going to happen. And the data so far shows that huge rise in cases. That's indisputable, and it's probably a total underestimate, the number of cases, around the 91,000. That's an underestimate of the number of cases. But as of yet, the Office of National Statistics data shows that the hospital rates still remain uncoupled from the rise. That means that they haven't risen at the same rate. And so we wait to see whether there's been an uptick in hospitalisation, because unfortunately, if there's been an uptick in hospitalisation, we will inevitably see an increasing number of deaths. What we do know is that if you're unvaccinated, you're more likely to be in that group that are in hospital, which is another prompt for people to get vaccinated, get their boosters. And so we do, and we also know that older people, and vulnerable people, are more likely to get affected. So far, there are many unknowns, and what that means is we just have to continue to take this seriously at a personal level, as well as look at the social controls that are put on us.
Sian, we are hearing, aren't we, of the possibility of announcement of maybe new restrictions coming in England next week. What would you suggest those restrictions look like? For example, should we be limiting travel?
It's very difficult to tell without looking at the data and thinking about all the different factors. So in a way, what modelers can do is the statistical modelers can produce a range of scenarios, a range of what would happen if, but it's modelling. It's up to the politicians need to make that balance between all the issues. It's not just infection with Omicron you need to consider, it's the impact on society, on people's mental health, on the rest of the National Health Service, on businesses and on livelihoods. And so it is a matter of continually adjusting decisions. So we see, for example, different decisions in Scotland and Wales from in England at the moment. And I think it's important that we emphasise the 7-day lateral flow is only in England at the moment. So there's a sense here about you need to see what's about to happen. But what you need to do is to decrease that social contact, because the virus passes on due to getting together in crowds. So cut back on, there will be maybe limit the number of people, households who can meet. There may be a closure of some of the non-essential retail sector. I think it's impossible to say, because it is a balancing act at all points, and it does depend on what the data continues to show us.
Chris, that data, we're still trying to analyse it, and you're looking at the science of it. I know you've talked to us in the past about how viruses can kind of weaken over time and become less of a threat, and there's this possibility that might happen with COVID. I was just wondering, can it also go the other way? Can a virus weaken and then get stronger, become more of a threat again, or is it always that it becomes weaker and weaker and weaker?
There are two rules, really, that I learned at medical school in this regard, and one of them is never say never, or never say always in medicine, because you can never be right. It really comes down to evolution. What benefits the virus to spread the best? And whatever changes it can endow itself with to enable it to spread better is really the path of least resistance for that virus, because it will lead to there being more cases. And if there are more cases of that particular form of the virus, then it's passing on the genetic makeup that makes that form of the virus. So really it will be whatever endows the virus with the greatest transmissibility, leading to the greatest number of hosts. So it's not a given that the virus will weaken over time, but it's a tempting hypothesis, and one that may be borne out by history, because back in the 1890s, there was what we then thought was a flu pandemic, which got called the Russian flu, which caused very severe illness to spread around the world. It did cause quite a dramatic loss of life, including in the British aristocracy. One member of Queen Victoria's close family lost their life because of it. We now think, for various reasons, and there's quite good evidence linking that particular outbreak to a virus called OC43, which is, guess what, a common human coronavirus that's now circulating and causing the common cold. It causes a few % of the common colds we see every single winter. And it comes in surges seasonally. We catch it many times across our life. So what we think has happened is that this was probably a cow coronavirus that jumped into people because of people keeping cows in close proximity to people. It caused a pandemic and has then adapted to us in the 100+ years since. We've also adapted to it, and we end up with a virus that's a better bedfellow for us. We'll tolerate it because it causes trivial disease. It's tempting to hope and speculate that perhaps that's the direction of travel that COVID will take in the long run.
So in 100 years, it'll all be fine.
And hopefully not in 100 years. The great virtue of having modern medicine and science is that actually we can throw vaccines at this problem, we can throw drugs at this problem, and we can basically fool our body's immune system into thinking, when you're in your 8th, 9th decade, that you've been seeing this virus across your entire life and therefore have accrued immunity to it, like someone who has been catching it their entire life and for whom it now is no threat. Remember, children have virtually no problem with coronavirus COVID infection.
That's really interesting. Thank you both so much. I'm really struck by Chris saying never say never in medicine. It's kind of the same applies to politics, doesn't it? And journalism too. Thanks very much indeed, both.
Pleasure.
Life in general.
Life in general.
Yeah.
Everyone.
Yeah. Now, staff shortages due to the rise in COVID cases has forced some rail operators to cancel or reduce services